Part 3, Dr. Randy Richardson, Dean of the Creighton University College of Medicine right here in Phoenix. You can see the building that he's got going up right behind him. Incredible community member, grew up right here in the valley out in Mesa, doing some really neat things. We were just finishing a conversation about diversity, some of the things that you guys are doing to lead the way here in the valley, and especially growing a student body that represents the community and what we can do to really support the marginalized and really support the growth of our next generation of leaders and docs. Something I when I look at Creighton, I think history. And we talked about principles a little bit earlier. When you think about history, Dr. Richardson, what do you wish we had learned from the past? And maybe what are some of the things that you guys are implementing now in light of everything that's going on to make sure that we continue to invest and enrich our community?
Yeah, a couple of things come to mind. One is that maybe the old country doctor had it right. Going and seeing people in their homes, in their environments, knowing them, knowing everything about them, that was really the right way to do things in a lot of ways. We've advanced, our population is significantly larger than it was before, but I think those principles that they knew then are really important today. That you bring a patient into your nice, beautiful office and you see them in a nice, clean environment, clean room, you count them on nutrition and exercise and all these things, and you send them back into their environment and they fail. We wonder why they fail, and we just don't understand. We don't understand the environment they're in and what resources they have available to them. And I think as we reach out in their environment and help them access resources in their environment where they live, I think we're going back to what we learned in the past, that's effective. And I think that's so crucial, and we really want to do more of that. We're starting to put together, as we talked about in the last segment, interprofessional teams. And we're hoping that these interprofessional teams can go into the communities together, working together to care for patients. And I think that's something we learned from the past that they did very well. And hopefully we're learning it now, that is the best way to care for patients.
Those are some of your Mesa roots right there showing through. I love it. And maybe tell me a little bit more. You touched in one of our other segments, you talked a lot about cost and that being one of the biggest hurdles to overcome. And you shared some ideas with us and led us a little bit into your area of expertise on what it costs for these young, these medical students to come through school. And when the cost is so high, that translates to the accessibility to the user, right? Or the end customer, and cost goes up for them as well. So maybe just touch a little bit on, from that standpoint of some of the things that you just shared with us, how are we transforming some of those things as a country and as a state so that we can get a little bit more back to that level of personable care, because otherwise we're just trying to run folks through the door as fast as we can to try to keep up with all the back end costs.
And I'm going to need smarter people than me to figure it out. But
of course.
Yes, you're exactly right that the cost of all of this is translating to healthcare systems who are trying to get some sort of eke out a tiny bit of margin, and they put pressure on primary care doctors to see patients as fast as they possibly can. And you just lose more and more of that actual the patient care. We get complaints from patients all the time that, well, I had a 15-minute appointment and, the physician spent most of the time checking boxes on the computer. It's inevitable. The poor physician's trying to do their best
to keep up,
just to keep up. And now, so they take their work home. So we've got to find a better way to finance this so that we can have quality care. And I think a school of medicine, school of nursing, school of pharmacy coming together and providing some labor where it's cheaper labor, right? That can help in some of this team sort of work that can be supervised by a physician, supervised by residents and physicians and faculty, but maybe keep healthcare down. Or the healthcare cost down.
Yeah.
I don't have all the solutions to that. That is a major
but
problem.
You did mention in a previous segment, one of the ways smart people can help us is by deferring some of those costs through philanthropy, and that then helps. So for you, that's with scholarships. We have a great donor that provides some scholarships for some of our nurses. But that's a great way for our community to invest in us, that then the downstream effect is better care, more accessibility, some of those things. So I do think you have one great answer.
Yeah, I think you're right. And I think we can try to do our best to control costs. How can we work together better as a team to
Right.
control costs? And maybe philanthropy for primary care. For primary care teams that can go into communities and improve healthcare and still give that quality care, because that's really one of the toughest things in our healthcare system is accessing the complex world that is healthcare, right?
Right.
That primary care person is really that front line that's got to do that and understand how to best do that. So maybe philanthropy focused on primary care and primary care teams in communities is really a focus that could help us. And the downstream effect of that could really be a huge cost savings in the end.
And I imagine with your background in pediatrics, you would focus a lot there, I would imagine.
Let's train our young people to be healthy,
Yeah, that's right.
Preventive care has got to be a big piece of this as well, to help people learn to eat healthy and to exercise and take care of their bodies in a way that'll make us healthier as a society.
That's amazing.
We met initially in the Family Learning Center, had a meeting, about a year ago, and we have a Family Learning Center in every one of our clinics and will in our new clinics. And it provides those wraparound services that families need, how to access insurance or how to access employment or, other support systems. And we're hoping that, that can also be some of the primary care training, that our students get as they come through and see that those are so important. And you've spent some time at when it used to be Maricopa Medical Center, just a little bit of time. So the kind of resilience and grit that we have there. So I gave you a lot, but I think we're a good, site as our clinics and our health system as a good site for training the future providers.
No question. It's really why Valleywise is such a great partner for us, right? You guys have been practicing this for decades. You not only just practicing healthcare delivery, but the training of physicians to become the healthcare providers of the future. We couldn't be happier with the partners that we have, because we have experienced partners that know how to do this and have already done it and are so now we get to join with them in having them teach our students how to best care for patients in the most economical, best environment that you can get. We're thrilled. In every, you can talk about the wonderful focal or sort of highlighted areas for Valleywise, your wonderful burn center and your behavioral health centers and all the great things that you're doing. But really, you're doing it in all aspects of healthcare, which is impressive. And you're teaching students in medicine, nursing, and all aspects of healthcare in OBGYN, pediatrics, surgery, psychiatry, all the different primary care areas that we need. So we feel like we're in the best position in the Valley as far as educating students because of our partners that we have. And Valleywise is a huge piece of that.
So Dr. Richardson, one last question. Tell me a little bit about these younger generations, and something that we hear a lot out of, say, like the tech industry is the disruptor. And a lot of times, I think the business community is very willing to take risks and come at things from that disruptor, and young people are as well. tell me a little bit about what you see out of these next generations, and maybe some of the positive change that they're bringing to the table with that disruptor style. You know, is it in nutrition, or is it in, you know, different ways to care, getting back to some of our roots as far as the more personable care? Like, just tell me a little bit about these kids, if you will.
I am a radiologist, and so by definition, I'm a little tech heavy.
Yeah.
And I just see the minds of the future taking technology to different levels that are really going to be disruptors. You know, robotic surgery, 3D imaging, all of the different telemedicines and telehealth ways that we're just it's sort of the tip of the iceberg right now. I think that's going to expand. And as these young minds start thinking of better ways to do things, it's going to be powerful. You know, I think of 3D imaging and how far we've come with that. You know, we can now take a CT scan and print out a 3D model that you can actually do the surgery on the patient before you do the surgery on the patient,
cool.
Right?
Yeah.
With that same exact anatomy, and we've done this all the time. But now as we get these younger minds who are so comfortable with technology and computers and gadgets and devices, starting to think about solutions to problems, I think we're going to get a whole new wave of what we can do. And so that's one aspect of it. But telehealth and telemedicine, I think the pandemic has really pushed us ahead.
That'd be my next question. Yeah. Yeah. And has that broken through some red tape? You know, has that progressed things for you guys?
Absolutely. And I think there's no turning back now.
It's amazing.
I think the patients have tasted the convenience of a lot of these appointments that they can make, and they can be seen via telehealth that they're going to want now in the future. And so I think this has been a wonder. You know, it's not a good thing, the pandemic, right? But it has helped us progress in areas that I think are going to help us in the future to be more efficient and to be more convenient for patients to access the healthcare system. So in some ways, it's a positive thing on the technology side of what has happened with the pandemic.
Well, and you also mentioned in our first segment, which is something that I'll always remember, is that the pandemic has helped galvanize principles.
Yes.
Which, if there's one thing, I would hope that we would anchor in from all of this is that. And it's just incredible to hear all the things that you guys are working on. As Lisa mentioned, your energy is amazing. I think the entire Valley should be thankful that we have a leader like you training the next generation of doctors. I know that I'm very thankful as a local here, and also someone that's been working with Valleywise for a long time, that we have leaders like you to collaborate and join forces with. It's really inspiring.
Well, thank you. That's very kind of you to say. But truthfully, the students inspire me. When we started this program back in 2012, these third-year students started here, and they, you know, their third year is a busy year. They're doing all of their core clerkships. They're up early, doing rounds, working all day, you know, often rounding late in the evening. But the first thing they wanted to know in the very first month is where they could go do service learning, where they could go serve in the community. And that's inspiring, you know, and they go down to Rocky Point in Mexico, and they go down to St. Vincent de Paul. This is on their evenings and weekends to serve in the community. Research was the same way. You know, they're busy, they're doing all these rotations. How much research could they really do? You know, they have just far exceeded my expectations. This last year, we had more than 2 peer-reviewed publications per student, you know, during their third and fourth year. Just amazing what they're accomplishing. And so they inspire me, and hopefully we can give back as faculty and match their energy to help them to do great things.
Well, when you're ready to open that health sciences campus there that's behind you, I hope that we can see you again. Maybe we can do a little mobile interview. We could bring our GoPros out or something like that and spend a little more time with you. This has been really neat, and we're so grateful for your time.
Thank you, Nate. Thank you, Lisa.
Thank you, Dr. Richardson.